Hello everyone, this is Gitana here again after a long time. Okay, so I'm here informing you about the hand instruments which are commonly used in a dental composite filling in our average dental clinic. So here's a list of instruments which you can also find on my WordPress page. So first of all, I would mention the primary instruments, which are our examination instruments, which are usually used in the examination as well as along with any other dental operative procedures. First is the mouth mirror, which is the most common thing, and it is used for looking at tooth surfaces in direct and indirect vision. This is a CPITN probe. This is not commonly used in operative procedure. It's usually used in community dentistry, but sometimes it's required for measurements. This is a sickle probe or an explorer. This is also used. It's part of the examination set, and this is our good old forceps to pick up things like cotton swabs and all that. Next come the handpiece. This is not exactly required in the filling, but it's required in the cavity preparation, which is done before the filling. So this is our high-speed handpiece, and these are the burrs, or some of the burrs that we usually use. Now we have the cutting instruments, which are used to cut the enamel or cut the tooth surface manually when we are being careful not to cut down too much of the tooth surface. So we do it manually instead of using a handpiece, which is much more riskier. So here we have these two are gingival marginal trimmers. One is mesial and one is distal. You can tell by the direction of the blade tip, which is in this case pointing upwards. So this is distal, and in this case it's pointing downwards. So that is mesial gingival marginal trimmer. These three are our hand excavators, spoon-shaped excavators, and these are just different sizes and different types. This is a triple angle. As you can see, it has 3 angles. These two are bin angle. Bin angle means 2 angles. See, 1 angle, 2 angle, and this is 3rd angle over here. So that's why it's a triple angle. And this is just 1 angle and 2 angles, so bin angle. This is the Dicel applicator, which is used to apply a thin layer of Dicel or calcium hydroxide as a cavity lining after you have made the cavity. This is a condenser. It is also known as a plugger. Both are the same terms used for this instrument, and it is used to condense or press down the composite after keeping a pellet of composite into the cavity. You just press down with it so it fits into the cavity shape. That's why it's called a condenser. Now we have our polishing instruments and our carving instruments. The carving instruments are, as you can see, this one is a kite-shaped, a moment. This is a kite-shaped carver. You can see it has a kite shape. And this is a discoid and clayoid carver. The carvers are for making the anatomical features on the composite after you have done all the layers. or carving out those features. Then we have the polishers, which is this is a burnisher. This is our burnisher. This side is the egg-shaped side, and this side is the round side. This is our acorn-shaped burnisher, similarly used for polishing the surface of the composite filling. So that's about it. That's about the most commonly used instruments in a dental composite filling, and I hope this video was informative for you all. And if there's anything other than that you want me to explain regarding this, please do comment. Thank you.